outbreak of encephalitis has caused several more deaths in India's Uttar Pradesh state.
Eastern Uttar Pradesh, where the encephalitis this year has impacted.
इसका असर बच्चों पे है, बच्चे मर रहे हैं, बच्चे जिनको यह संक्रमण लग रहा है वह अपाहिज हो जा रहे हैं. हमारा लड़का 7 साल का था, उसी समय उसको बुखार हो गया. जब बुखार हुआ तो पागल जैसा हो गया, उसका दिमाग काम नहीं कर रहा था, इधर उधर भागना शुरू कर दिया. गांव के डॉक्टर से दवा कराए, नहीं सुधार हुआ तो यहाँ से मैं कसिया लेकर गया. और कसिया में जब दवा हुआ 1 हफ्ता नहीं ठीक हुआ तो रिफ़र कर दिए तो गोरखपुर मेडिकल कॉलेज गए. वहाँ से दवा जब चलना शुरू हुआ तो धीरे धीरे सुधार हुआ. जब बुखार ख़त्म हो गया तो उसका दिमाग काम नहीं कर रहा था.
Generally, when the child had fever, they preferred going to a quack because it was one of the most accessible options available. So a lot of time was wasted because unfortunately even the primary health providers and the families could not catch the early warning signals or the danger signals of the disease.
गांव में यह है कि जेई शब्द से हम कहेंगे तो गांव में किसी को ये मालूम नहीं कि जेई क्या है. उसको जो नौकी बीमारी से हम कहते हैं कि नौकी बीमारी हो गई है, तो इससे भयभीत लोग हैं.
Somewhere down the line, I thought that the community itself overall had accepted the disease. They had accepted that there is lack of knowledge, such that's happened. It's not something very new. They accepted that the service delivery is very poor, and this is how it is, so nothing can be really changed.
Accepting death as an almost essential outcome of this particular sickness is unacceptable, and that needs to be disseminated amongst the people. That may be a result of mass cynicism or maybe disillusionment against the primary healthcare system. That's happening because the parents are not contacting. Because of the lack of trust between providers and the ultimate the end user, the client.
जो ये जेई की बीमारी है, तो मेरा जहाँ तक अध्ययन है इसमें लोगों का कुछ जानकारी नहीं है, लोग जागरूक नहीं हैं.
The burden of Japanese encephalitis and acute encephalitis in the state of Uttar Pradesh. Historically, the state, especially the eastern UP region, has been contributing close to 50% of the total burden in India. And within this region, Kushinagar as a district has been contributing to maximum number of cases. The region is characterized by heavy precipitation, and also it is full of paddy fields, both of which make it very conducive to the breeding of vectors.
control of these mosquitoes in outdoor situations is rather extremely difficult. We don't have right now in India any tool to tackle these mosquitoes who are resting outdoors. We at the moment have only indoor resting, control of indoor resting mosquitoes.
Japanese encephalitis virus occurs in nature through mosquito pig mosquito cycle or through mosquito bird mosquito cycle. Pig act as amplifier host for Japanese encephalitis virus, and viremia also occurs in pigs. Therefore, the pigs may act as an important source of this virus for human beings or other animals too.
हम खुशीनगर ज़िला में रहते हैं और वो जो रोसू जी नई पट्टी के रहने वाले हैं और एक टोकरी वोकरी बीनते हैं, सुअर पालते हैं और जो याग उग देते हैं, यही काम है हमारा। तो मोछड़ का बीमारी जानकारी है, जो काटता है तो ज्वर चढ़ जाता है, मस्तिष्क जड़ हो जाता है। इसका कोई बीमारी नहीं है यहाँ पर सुअर पड़ने के लिए। हाँ, वैसे मच्छर वच्छर कुछ भी नहीं। अब तो सुअर का लगे रहते हैं हरदमेशा, हम लोग का कहीं मच्छर नहीं लगता है।
जेईएस का केस मानसून के समय में सर्वाधिक आते हैं, जुलाई, अगस्त, सितंबर, अक्टूबर। इसमें धान की खेती का क्षेत्र ये है, इसमें मच्छर पनपने लगते हैं, जिसकी वजह से ये बहुतायत में जुलाई, अगस्त, सितंबर, अक्टूबर के समय आते हैं।
This was a unique study, I would say, because it has a different component.
The scientific community has been unable to recognize the complexities of JE and how it is transmitted in these regions. Traditionally, our approach has been rather linear and a biomedical kind of approach to trying to understand Japanese encephalitis, whereas there are different layers and different determinants which range from the biomedical to the socio-economic and the cultural and the environment put together. So all of that makes it a rather complex disease and therefore complex set of interventions.